let's begin our last chapter of the textbook, which is on therapy, right? Treatment, psychological and biological treatments for mental illnesses or problems, which we learned about last chapter. Psychotherapy is a word that is very broadly defined. Your textbook defines it formally as a psychological intervention designed to help people resolve emotional, behavioral, and interpersonal problems and improve the quality of their lives. What are we getting from out of this? Well, it's a psychological intervention. It's not a pill. It's not a lifestyle intervention like making somebody eat healthier or, have a better sleep schedule or do more exercise. It's psychological. Okay, you're basically talking to the person, trying to understand what's in their head, maybe get them to think differently. And it's supposed to help them, right? They have some kind of a problem and it's supposed to help them solve the problem. Like you're not trying to make them worse or undermine them or get information out of them that could use for research. No, you're trying to help them solve a problem that is in their mind, that they're holding in their mind. It's not like they have a bleeding wound or they say, hey, stitch this up for me. There's something that troubles them cognitively, emotionally, and you're going to use a psychological intervention to help them with that. So stepping back, somebody has a problem that's basically kind of in their head, and you're going to talk to them about it and try to solve it. You do psychotherapy a lot with your friends and your family, and they do it on you too. Because what do you do when you're troubled with something? Something's on your mind. You go and you talk to your friend about it. You have a conversation. They make some suggestions. You offload a bit, then you feel better. Broadly defined, that was psychotherapy, though your friend isn't licensed, and you didn't have to pay them $200 an hour for it or put it on your health plan. But very broadly, psychotherapy is something that we've broadly understood. It's something that we've been doing for eons, right? As social animals that trust each other with our problems. So when the textbook says that 20% of Americans have received psychotherapy at some point in their lives, lifetime prevalence, now they're not talking about psychotherapy broadly defined, because psychotherapy broadly defined is something that 100% of people have received, right? All of you have had something heavy on your heart, been troubled with something. Maybe it was a breakup. Maybe, you don't know what to do with your life, and you've gone and gotten help from some other human about it, right? But that's not what they mean. What they mean here is like licensed psychotherapy from licensed psychotherapy. What they mean is that you saw some kind of a licensed provider who gave you some kind of official form of therapy that is like medically recognized by the psychological associations and the psychiatric associations. And that they gave you or your insurance company a big bill for it. That's what they mean. There are demographic differences in who uses this kind of official psychotherapy. And this slide before I edit it said, females go more than males. Yeah, women are more likely to go and seek help and seek social support, right? White people more than minority groups. Wonder what could be going on there. Could be a few things. It's a white majority society. Maybe most therapists are white. Maybe this is kind of something that's ingrained into the dominant majority culture that you should get therapy. And, maybe minorities feel kind of left out of that. Let's say you have an Indigenous person who's facing Indigenous issues. Would their likely white therapist get that? Over 80% of psychologists in America are white. Because being a registered psychologist means usually you went to graduate school, right? That's expensive. There are many, many barriers to getting through grad school. I can tell you about them. Okay, so at the end, you have it's a very you have a small group of privileged people who are offering these services. And how well would somebody from a minority group or from a marginalized or oppressed group, how relevant would that be for them? That could be one reason. And sometimes, people like to seek support from therapists who are similar to them demographically. The evidence we have suggests that, you can be helped by anyone. For a therapist to be helpful to you, they don't need to be of your gender, they don't have to be of your race, but they do need to understand you and your issues. And when it comes to particular issues, sometimes you need somebody from your group. So I could imagine somebody who's queer, who's LGBT, that deals with, very specific issues around that kind of marginalization might benefit from having a therapist who is also a member of that group. Then I added this. It's in the textbook, but it wasn't on the lecture slide. But I added it because I thought it's so important. Socioeconomic status. For this kind of official psychotherapy, you need to have money. In my province, the official rate for registered psychologists is $225 an hour. $225 an hour. Do you think you're going to solve your psychological problem, your depression, your deep insecurities in an hour? No, like that first hour, you're like filling in questionnaires? And how many psychotherapy, I think, is supposed to be traditionally like 3 sessions a week. And how many sessions do you need to address your problem at $225 an hour? Okay, so you have to be rich to afford that. I have a lawyer, and she costs me $150 an hour. A psychologist costs more than a lawyer. And, I get a bit of a help from my lawyer, and I get like a $1,000 bill. So, rich people can take their problems to psychologists and to lawyers. Psychiatrists also can do psychotherapy, but they're more like medically based. They're more likely to give you a kind of prescription, be like, see how this works and come see me in 6 weeks and we'll titrate the dose. Now, let's say that you can't pay $225 out of pocket for a psychologist. Well, maybe you have a health insurance plan. But who has health insurance plans that cover, psychological therapy and medications and eyeglasses and massage therapy sessions and this, that, and the other one? To have one of those plans, you basically have like a full-time professional job. Right? When I was working at McDonald's, I did not get a benefits plan like that. In academia, there's different levels of professor. And the high-level professors, the full-time professors, of whom there are much fewer, would have these health benefits plan. But people like me, there's many, many more in academia who are kind of adjuncts or contract-based. We don't get benefits plans. Okay? If I have one, it's because I have a partner who has a professional job and he has it and I'm a beneficiary. So basically you have the money, so you're rich, or you're class privileged enough to have a professional type high status job that comes with one of those plans. Students get health plans though, and going to university is actually a very class privileged thing. Okay, going to university is like normal de rigueur, expected if you were upper class, upper middle class, and it's not expected if you're working class. And students from working class backgrounds can struggle when they come to university because they're now in this kind of upper middle classish environment that they may not align with in many ways. So, hi SES. This summer I went to present at the Academy of Management conference in the United States. The Academy of Management is like the most prestigious academic management organization. So it's prestigious, it's fancy, there's lots of like rich academics there and sometimes fancy business people. And, it's like a 3-day affair. maybe, and there's all kinds of talks you can go to and workshops. And I went to a workshop on fear of failure, and it's burned into my memory, but there's all these upper middle class people or people who are desperately trying to climb in or stay in or climb even further within the upper middle classes. And it was like the worst thing to them is this idea of failing, and they had this fear of failure, and it was like this traumatic thing for them. And I remember thinking, like, what are they really afraid of? Like, not landing a tenure track academic job, being embarrassed in front of their colleagues, not ever being the keynote speaker. Like, what's the worst that could happen to them? Let's say they didn't get that tenure track. They didn't get tenure, then what? They're going to get some other professional job somewhere else. They're almost certainly not going to end up working the cashier at Sobeys. So it's about kind of being in and staying in and getting further up that kind of class ladder. And I remember how fragile they seemed. And another thing that I remember from that workshop is that it was really emphasized that, you should be in therapy, and it's so important to have a therapist. I was like, yeah, you can afford that. The terms like psychologist and psychological services may be protected, like legally protected. You guys are in New Brunswick, and New Brunswick has its own legislation about this. I'm in Nova Scotia, and Nova Scotia has its own legislation about this. And in Antarctica, there is no legislation about this. And so you can go to Antarctica and say you're a psychologist. In fact, I think possibly there's no legislation about this in the Yukon. So if you want to go be a psychologist with a PhD in psychology, you can go to the Yukon. So these terms and how they use them are legally protected, likely legally protected, and that legal protection is based on jurisdiction. In my province, I'm in Halifax, Nova Scotia. Under the Psychologist Act, I can say that I'm a psychologist. Can I say it to you in New Brunswick? I haven't read the New Brunswick legislation. Let's pretend that we're all in Nova Scotia. I could tell you that I'm a psychologist. I could say as a psychologist, but it's only in a certain context that I'm allowed to use it, right? It's the teaching of psychology. It's because I have an academic appointment to teach psychology. It'd be weird if you had a university instructor teaching math and they weren't allowed to call themselves a mathematician, right? But I cannot go and diagnose a student with ADHD, right? Even if I thought they met all the criteria and I read the criteria in the DSM and I understand it, I don't have the authority or the qualifications or the licensing to do that because I do not have a graduate degree in clinical psychology, and I didn't jump through all the hoops in order to be registered as a practicing psychologist. So what would I do in that case? And I've done this before if I think it really looks like a student is struggling because of unaccommodated neurodiversity. What I would say is, I've noticed, I've observed these traits or these. And, this sounds to me as if it could be, say, ADHD. And how about, could you get an assessment? I advise that you, go to the school counseling center and talk to somebody there, or go to the health center and see if you can get a referral. Right? And then it'd be off my desk, and that diagnosis would be made by somebody else who actually has the right licensing and qualifications to do so. These matters of jurisdiction are important because if you can't use a kind of protected term, like I could not say that I'm a clinical psychologist and offer what I highlighted there, the term psychological services. In Nova Scotia, the term psychological services is legally protected. And if you do not have the right authorization, you cannot just sort of go and put an ad out in Psychology Today and say that you're offering psychological services. Even if you could actually do the work and you were brilliant at it and you're an amazing diagnostician, you'd get sued for that by the College of NSBEP. There's a board of examiners for psychologists. They would not let you get away with doing that. But you could do it in the Yukon where they don't have that law. One of the concerns, issues, etc., around licensing is the way it opens up kind of economic opportunities for you. So if you want to be doing psychotherapy, well, heck, you don't need a degree or a license in order to do it because you're already doing it, right, with your friend that's crying on your couch. But let's say you want to get a paid job doing it. Now that's different because the hospital is only hiring a psychologist who has a graduate degree and registration, etc. Okay, so the opportunities may be limited around licensing or registration. What else? There are some terms that, depending on the jurisdiction, may not be protected at all. I know that in Nova Scotia, the term therapist is not protected. That's probably the case in New Brunswick too, because you could say that you were a Reiki therapist, right? Or a astral projection something therapist. You could be a horse therapist, or you could have a therapy dog and do dog therapy. That's not a protected term. But so let's say you call yourself a therapist, how are you going to get business? Now that's the issue. So you advertise yourself and clients come to you, and one of the first things they want to know is whether they can build their insurance plan. Because many folks who are, fortunate enough to have kind of middle-class jobs have this benefits plan, or they're students like you, and maybe your student health benefits plan says that there's coverage for like $1,000 worth of psychological services. So you get like 5 sessions, but you're not going to go get those 5 sessions for somebody you have to pay out of pocket for, even if it's like $50 an hour. You want to go to the person that's covered under the plan. And the health insurance companies, Blue Cross or whatever, are only going to have that relationship with the licensed providers. There are many different kinds of mental health professionals. By professional, I mean they jumped through all kinds of, they might not be a psychologist, but they jumped through all kinds of different hoops in terms of education, formal education, graduate education, and there's some kind of a professional oversight body, and they may or may not be people who can bill insurance companies, but clinical psychologist isn't the only way to go, right? Psychiatrist is also a profession, but you go to med school for that. They are doctors, like MDs, and they can prescribe medications. Clinical psychologists cannot prescribe medication, and there are some types of patients that need to be treated with medication. Imagine if you have somebody with like schizophrenia and they're having hallucinations. Like, what are you going to do? Sit there and be like, how does this figure you are hallucinating represent your mother? Like, no, they need medication. And medication often works better or works well in complementarity with medication, but to prescribe that medication, it's a psychiatrist or a family doctor. And maybe as a clinical psychologist, you would communicate with somebody's doctor through letters or be part of a bigger team where you have some contact with the doctor, but you wouldn't be doing the prescribing. Counselors still do psychotherapy. It's counseling. You don't see the person really as a patient, and it's not about diagnosing mental illness. Traditionally, counseling is done in a social model. It actually developed out of vocational counseling, career counseling, but careers are to be understood holistically. You have to look at, because career is about the sum total of a person's social role across their life course. You have to see them as a whole. And so these mental health issues come up. Other personal issues come up, but traditionally it's in a social model, and you're not seeing the person as like broken or diseased or mentally ill. However, there's been a movement in counseling to get medicalized, Why? Not because it's consistent with their values, but because counselors, like registered counseling therapists, want to be able to bill those health insurance plans. There are people like psychologists who help students in schools. Let's say somebody's not learning very well. Might work with a student to try to get them set up for success. There are educational psychologists who deal more with like higher level research and policy things than a school psychologist. That's more of a one-on-one with a student type relationship. There are social workers who help people navigate systems. They often do, counseling in practice. There are psychiatric nurses, like I told you about my friend's mother, who's a psychiatric nurse, and the experiences, the things that she saw in her position. And, you don't have to do counseling within a medical model or even a mainstream social model. A lot of people have religious beliefs and want to navigate their lives in a way that's centered or grounded in their faith, right? They want a Christian therapist. They want a Jewish therapist. And so there are counselors who work in sort of spiritual contexts and in sort of spiritual ways. There are, many people with no professional training in counseling or psychology who are still professionals of one type or another and are basically providing some kind of psychotherapy. And I think the picture that I didn't come through here, but I had a picture, had intended to have a picture there of a student in a prof's office. I am not trained in counseling or in psychotherapy, but when there's a student crying in my office, I end up doing that kind of thing. Right? When exams are coming up or when there's assignments and students are struggling in their academic distress is often connected to some kind of a personal reason, like their life is a mess. They just went through a breakup. They might have some kind of a condition, and I end up having that conversation. So in the context of psychotherapy, I am a paraprofessional, and so is maybe a nurse. There are many other types of professionals who end up doing some kind of psychotherapy or counseling, and I think that's particularly true for teaching. And in fact, many counseling programs are actually housed within faculties of education. Paraprofessionals can be as effective as the standard types of trained professionals in psychotherapy. They don't have to be professionals at all. Like, let's say you have some deep personal problem. Who helped you get through that? Let's say the last crisis you had. Was it a clinical psychologist? Or was it like your best friend, your family, like elders in your religious community? We get help from a lot of different places, and the skill in helping isn't really owned by these few licensed professionals who are trained in particular ways. There are reasons for choosing those professionals if you can. Ideally, they would offer more evidence-based treatments. However, there's a lot of kooky professionals out there. I had psychotherapy from somebody who was obviously working in the Freudian tradition, and that is not evidence-based, but it can be very official. There's little to no difference in effectiveness between trained and untrained therapists, between experienced and new therapists. You would think that experience made the difference. It doesn't. There's many reasons for that. Sometimes the more experienced therapists get, the more kind of set in their ways they get. They might get arrogant. They might start departing from official manuals and relying more and more on their intuition and clinical judgment. The last psychotherapist that I saw was very confident in his abilities, and I thought he was very off the mark, and I couldn't tell him. Basically, I needed to get a diagnosis from him in order to get accommodations, and I got that. I thought the diagnosis was questionable. Honestly, that was my ADHD assessment and diagnosis. It happened in a very I found the clinical interviewing very messed up, very Freudian, very focused on my relationships with my authority figures. But at the end of the day, I had to see that guy, not because he was helping with me with my neurodivergence at all, but because he was licensed to write this letter with a piece of paper that had a diagnosis that I could then give to the accessibility center at the university. And let's say my best friend is way, way better at actually helping me with my neurodivergence. She can't write that letter and be like, yeah, I think Tanya has ADHD. No, it had to come from him. And I had to go through all the BS about parental authority figures and pay him $3,000. But that's because of the way the systems are. So benefits to seeing professionals. Another one is that there are codes of ethics that stop them from doing things that they might otherwise do. If you talk to a friend sometimes, or a colleague at work, they'll go and gossip about it. And you end up in a much bigger problem than you had before because of the disclosure. Professionals are, they understand the rules around confidentiality. And so it can be safer to talk to somebody about these personal issues than somebody like actually in your personal network, when then maybe they go talk to other people and all gets complicated and blows up in your face. Liam has a comment that's about why there doesn't seem to be a difference in effectiveness between new and experienced therapists. That's significant because if their effectiveness is about their skill, if they're more skilled, they should be more effective. Liam says, I feel like experienced therapists might get cold. They would deal with so many broken people, and how many of them would get better? Sure, they could be burned out. They could have become cynical. They might come to the point where or maybe it's the opposite. Maybe they're no longer engaged and it's a churn for them. They're like, yeah, okay. Maybe the new therapist is like, wow, I'm so into this. I'm listening. I'm all ears. Something I learned from CPA that I didn't know before is apparently therapists in therapy sessions will just get bored and stop listening. And then they don't know what you've been talking about. And then they'll come back and they'll be like, tell me more about that. Or say something that makes you think they were listening when they were actually not because they spaced out. Never occurred to me that they did that. In my head, they're just totally analyzing you all the time and definitely paying attention. No, they check out too. So there is research on what seems to be effective therapy. So when it seems that a person is helped, well, what is that because of? Well, it doesn't seem to be based on therapist licensing or training or experience, or arguably even the particular kind of therapy they're doing. It seems to have a lot to do with the quality of the relationship. Right? They should be warm, authentic, right? Seem to care about you. That therapeutic alliance is worth a lot. The first, let's say you have an issue and you need to see a psychotherapist for it. The first therapist you connect to or refer to might not be a fit for you, right? That person might have a mindset or values or a worldview that are just not, or a style that's just not aligned to you. And so sometimes you have to keep going, right? The psychologist I would sort of see now if I needed help that was above my ability. Oh boy, she's not the first. She's, maybe the fifth. I highlighted in the next one, says tend not to contradict clients. I was like, tend, because I think that therapeutic alliance is very individual. And I'm a sort of argumentative person. I like ideas being challenged. I like being very forthright. I'm a critical thinker. I did not get anywhere in emotion-focused therapies and therapies where they want to talk about your relationship with your mother. And I'd be like, oh, my mother. That I didn't, but I started making real progress with a counselor. This was at Dalhousie University, who is I think in a cognitive tradition, and who was arguing with me, and he was sort of he was debating me, and I was into that, and I made a lot of progress. So, but maybe that's because of my disagreeable personality. Like maybe there's agreeable people who need that kind of more caring and soothing and validating and empathizing with emotions thing. So I want to recognize that fundamentally that therapeutic relationship, that therapeutic alliance can be very particular to the dyad. Of course, you want them to talk to you about what's important and have productive conversations. And if they come up with a treatment, it should be matched to your needs. What should you look for in a therapist according to your textbook? Well, a lot of these things are signs of a healthy relationship. A lot of these things are things you would want from your life partner, right? Someone who listens carefully, somebody that can understand your feelings and empathize, somebody that you feel free to disclose with, right? And they're not going to judge you harshly for that. Somebody you can be open with, right? Somebody that shows warmth, that gives you good feedback. Okay, somebody that's honest with you, somebody that encourages you to confront rather than avoid your challenges. This sounds like somebody you should marry, doesn't it? And you would want them to be using scientifically based approaches. I would rather have a therapist that was doing cognitive behavioral therapy than that was doing this Freudian psychodynamic stuff any day. And they should be paying attention to what's working. And if something isn't working, they should be willing to sort of change course. They should be getting your feedback, because there are a lot of different sort of techniques they could use. So sometimes the relationship doesn't work. Sometimes we think that we are getting helped and we're actually harmed. And so this is what, a bad relationship looks like. Right? If somebody doesn't listen to you, if somebody wastes your time, right? If they're too authoritative or directed, if they're, they're vague and they're not clear about what you're supposed to do. This sounds like a bad professor, doesn't it? They should be willing to explain the scientific support for what they're doing. And they might not want to, or they might not be able to if they're using one that's not scientifically validated. And they should be observing professional boundaries, right? They should not be talking about their personal lives to you. They should not be trying to date you, etc. And you should be able to tell them when something isn't working. And ideally, they shouldn't get defensive. I had a difficult therapist who's in the psychodynamic mode who, said some things about me that I thought were completely untrue. And I couldn't tell him that they were wrong, because then he's like, no, you're in denial. Right? Like, that wasn't a relationship that I decided to continue. And then finally, be aware that therapists have their own styles, their own backgrounds, their own biases. Oftentimes people end up going into psychology and mental health because they have their own issue, right? They have their own Achilles heel, their own bugbear, and they see that in everyone else. Kind of like when Freud had this thing with his mother, and he's like, oh, it's a universal rule that all little boys have, desire for their mother. Everyone goes through this. And so they might be like projecting their own traumas and their own issues onto you. And if they have like a kind of pet theory, they might apply that to everyone, right? So I would suspect that psychologist I saw is talking to everyone with anxiety and other clinical issues and BPD as like about authority figures in their early life. And you know what? Maybe that's more about him than about them. So a one-size-fits approach to all problems or clients probably isn't effective. I see I went a few minutes over time, so I'm going to thank you for your attention, and I will continue this with Insight Therapists on Wednesday. So thank you.